All right. Hi, everybody. Very good evening. Thank you so much for joining this online session titled Saving Lives Together, Awareness about Early Breast Cancer Detection. So as we all know, March, we typically have a lot of events that are related to women because 8th of March is celebrated as International Women's Day. And at the Here a Million team, we felt it was really important to spend a little bit of time talking about women's health because I'm sure we all agree that health is something that's very, very important. And to help talk about this subject, we didn't have to look too far. Within Enable India itself, we have some really interesting work going on with other partner organizations like Cytecare Hospital. So where we've all come together for this event, and to make this event accessible and inclusive for everybody, uh, we have a couple of inclusion measures in place. Firstly, we have Dr. Renuka and Manisha from ASLI who will be the interpreters to ensure that information is accessible for the deaf who are joining. And we also have captioning, in case anybody would like to refer to that. So those are some of the measures we've taken for today. So to just tell everybody here the flow of the event. So to begin with, we have two subject matter experts from Cytecare Hospital, and these are experts who are really busy. So we really appreciate the time that they have been able to chalk out for us. Thank you so much for that. And once we hear from our experts from Cytecare Hospital, we will have a question and answer session with staff members from Enable India who work on this program, which we will talk about later. So to begin, I would like to just very quickly introduce, our two subject matter experts from Cytecare Hospital. The first is Mr. Amit Sharma. Thank you so much for joining, sir. So Mr. Amit Sharma is the Chief Information Officer and Head Partnerships and CSR at Cytecare Cancer Hospital, and he comes with over 20 years of work experience in this field. There's a lot more that one can say about him, but I've just kept it really brief. And our second speaker, who will also be joining us later, is Dr. Puvamma CU. She is a senior consultant and director, breast oncology at Cytecare Cancer Hospital, and she comes with over 10 plus years of work experience in the field. So we have two individuals with a very in-depth domain expertise. So to just understand a little bit more about Cytecare Hospital and some of the work that they're doing in this domain, I would now like to hand over to Mr. Amit to take it forward from here. So over to you.
Thank you, ma'am, and thanks everyone for being part of this, and special thanks to Ashwini, who has been our, I would say, a pillar of strength for this program. Rather, I would say probably the genesis of this entire relationship, which we are really proud of with Enable India. So I think probably it would be in third year of its sort of an association. I'm bad at remembering dates, but definitely it's third year, if not more, that we have uh, worked with Enable India, and it all started with Shalini, who came to meet me once in their hospital, and she shared uh, an exciting program which Enable India was anchoring with a couple of partners of their own ecosystem, National Association of Blind, and a few of the other partners, including a German entity, where these girls who are visually uh, challenged but equally competent, they were getting trained in some of the life skills, as well as sort of a practical training in clinical breast examination under the supervision of trained trainers who were trained by the German trainers. So Ashwini is one of such trained trainers. And uh, so the ask from Shalini and Ashwini when they met us was that they are getting these girls trained in Enable India office on so-called theory come practical, but it is more using the mannequins, and probably some of their staff members are volunteering. But what typically was missing in this entire program was a clinical oversight or a subject matter expertise, because this program entire, and Ashwani can pitch in anytime, and Ashwani feel free, because the entire premise was that these girls who were lacking the visual sense were kind of having an extra tactile strength in their fingers, because of which they would be able to find very minute, very small nodes or palpations or anything which is abnormal in female breast. And using this and is this sort of a premise, the entire program of discovering hands was built. And they were training these girls, and they approached us, and they said that we have four or five, I don't remember the number, maybe five of these girls who were almost about to complete these programs. And they sought a help that if Cytecare can provide them a sort of a practical experience in the healthcare in the hospital, where they can do the same sort of a screening on maybe healthy women as well as possible cancer patient, because we are a hospital. So there is a possibility that there is a high chance that we might get more cancer patient than any other place. So they said that, let us, if we can work together, we will initiate this screening sort of a validation. And we then built up a program. uh, I reached out to our management, and fortunately our CEO and founder was also very very positive, very supportive of this idea. Then we had meetings with some of the doctors, and Dr. Puamma, who is the anchor of this entire program at Cytecare. She she voluntarily agreed that okay, I will make sure that these five girls who who will be getting kind of who are trained, they can come to hospital. They can spend about a couple of months, 2 3 months in the hospital, and we will find out a way that we can increase their practical sort of a experience. So how do we do that? Something that we kind of figured out. So one was, we kind of volunteered that entire women folk of our own hospitals, they were given a sort of a request that we have started this program, and we really wanted these girls to get experience, so you all get yourself screened by these girls. And hospital actually went a step ahead, that we said that you will not only get screened by these girls, but we will also get you mammogram or ultrasound mammogram if required. And then we will sort of kind of parallelly study that what the mammogram and ultrasound are giving and what these girls are reporting. And both the reports will then be read by the breast oncologist, which is Dr. Puama. And we did this. And this was done during a couple of months. And to our, I would say, to some extent, a surprise, we found that the girls were equally competent. So whatever, as far as I remember, there was not a miss, not a single miss of any lump or node, which was which would have been evident in the scans out there. Rather, I would say they were able to find some of those minute things which normally a doctor were also sometimes not able to miss, because these girls were doing it with their full focus out there. The important point to note here was that this was a screening method, this was not a diagnostic method. So idea was to find if there is anything which is abnormal, then they were asked to report to the doctor Now, in this scenario, some of them were earlier because they had a, I would say, the mammogram or ultrasound done, so it was available. But later course of the time when the program developed, so this program is developed that way that these girls go out into the communities, they screen the healthy women. Uh, if they find anything which is abnormal, actually they report everything, in the sense if there is a normal report also. So there is a very structured report which is being prepared by in a format which is agreed by our doctor and Enable India. So this report is I mean, these girls capture uh, their findings, including the history of the patient, and this report is then sent to the doctor, and the doctor then reviews the report. And if the doctor finds anything which is abnormal, then she suggests that if possible, the patient can come either to site care for a consult with doctor, and if any diagnosis is required. But we have done programs even outside Bangalore, in many of the other places, and within Bangalore also in multiple places. So there is no mandate that they have to come to site care. They can go to any of their nearby doctor. The advice is to go to a breast oncologist, but if they don't have access to a breast oncologist, they can at least go to a gynec oncologist or a gynecologist and show them the reports. I'm very proud to say that in these 3 years, 3+ years, because COVID came in between, so there was
Yeah.
obviously a big challenge that came. Everything kind of stopped. But these girls, if I remember, at a very high level, I would say now they have done close to 1,000 screenings
Yeah.
in different settings, and these settings are varied. They have done, say, screenings in residential societies, they have done screenings in colleges, they have done screenings in some of these camps. uh, uh,
Police quarters, ISRO,
yeah,
recently, yeah, now it is going on at ISRO, and tomorrow also, and
yeah.
at the Biocon, SAP, all the corporates also we have pitched.
Yes. So the most important point to note here is corporates. So as Ashwini mentioned, and there are, uh, see, that was the entire premise of trying to stitch this program, because many times women are not very keen or open to walk up to a hospital and get themselves screened because of varied reasons. Sometimes there is a distrust in the healthcare system itself. Sometimes because they are more busy, they can't travel. And sometimes there is a fear, inherent fear, that they will go to a hospital and they might find something else. Now here, this kind of screening is done in such a friendly sort of atmosphere, uh, and a very, I would say, safe environment. Ashwini is part of many of such screenings, so Ashwini will be able to give a little more insight how it is conducted. But I can tell you, it's one, first and foremost, it's extremely safe from a woman, because we know the sensitivity attached to it. So uh, each girl does a screening of a single lady. It takes around 40-45 minutes. They completely take the history of the patient, and then they perform the screening, record it, and then share it. uh, so this is how it is being done. Um, Enable India, I would say, has been the torch bearer of this program. So this, I think, say, Bangalore, we were the first hospital, because of the references of the work that we did, and Ashwini and her team's kind of outreach, and I would say a lot of persuasion, they were able to convince Apollo Hospital last year. So Apollo is the second hospital. So now these two girls, so two girls are permanently deployed at Cytecare. They were part of the first lot who were there in trained in Cytecare. And in Bangalore and in Apollo, I think there are two or three. There are few other hospitals, I think, in India where they are doing, maybe in Gurgaon, if I remember. But the entire, I think, success of this program lies, and we all say every time, is it depends that how much confidently we are able to take it up to the community and explain to them the importance first of screening in women for breast cancer, and then give them an option to get themselves screened, maybe at their own home or office, rather than them coming to the hospital. So this is what I just wanted to mention. Ashwini, maybe you can add, and then if there is something else, then I'll probably add.
Yeah. Thanks, Amit and Dr. Kuwama, for trusting Enable India and the Discovering Hands program. We thought Discovering Hands at Bangalore would have not been existed. That is what I wanted to highlight here. When we thought that we will start with the training program, we actually started with the pre-training, and the COVID happened. We had to stop, and a lot of struggle, as you all know. And again, we somehow we managed to complete the training program, but there has to be one hospital who will recognize Discovering Hands program, who will trust, and then these girls have to go for the internship as a part of the training. So there we struggled a lot, but Shalini, Jacob, and Amit, as he already said, Amit trusted our program, and we started the internship at Cytecare Cancer Hospital for 3 months. So from there we got to know, okay, this makes sense. Okay, Discovering Hands program is a very good program, and then we wanted to continue, but because of the second COVID, um, then again we stopped in between for 8 to 10 months. Then we thought, okay, we will end it here. Then last meeting, we thought, okay, I and Shalini went to site care and spoke with all the doctors. We thought, okay, we will end it. I very well remember that day, but because of Dr. Kuwama, she said, no, this is a very good program. You have to do it. And it is a very good livelihood opportunity for the visually impaired. And it also it is like a self-paced examination. So you have to continue doing it. Then after the meeting, again, Shalini and myself thought, okay, yes, we have to do it. Then again, we started our second batch, and from our first batch, Aisha and Noor, who have been uh, doing the work there. Okay, they have been employed at Cytecare, and after that, we started our second batch training because of the responses what we have got from Cytecare. And now all four of the second batch girls we'll call them as medical tactile examiners are currently interning at Enable India, and we have tied up with Cytecare and Apollo Hospital. Both have been giving us a lot of screening opportunity, and we are constantly depending on last year. We have like this year, our girls are fully engaged with the candidates, and for the first time, I've been maintaining a calendar because so much screenings are happening, and I'm feeling very proud of that because before I was constantly calling people, hey, can we do the screening? But now the people are approaching me. That is a one change I've been seeing, and thanks site care team, and I think Dr. Puwama has already joined. Maybe Gayatri, let's because she will be busy, and next week I
Sure.
can take it up later.
Sure, sure. Thank you so much, Amit sir and Ashwini for setting the context, telling us about the partnership and just about the Discovering Hands program. I'm sure many of us who have joined the call are very intrigued to know the details. How does a woman with vision impairment actually do the screening? So we will get into those details a little bit later. But now I would like to invite Dr. Puvama to come and just share a little bit about what all of us here, can be aware of when it comes to early breast cancer detection, health. Any advice that you can give to us, we would love to hear from your experience and expertise. So, would request you to please share your experience.
Yeah, hi. Hi everyone, Dr. Puama here. Yeah, I think Enable India with his Discovering Hands has done a good job training these girls. And breast cancer is one of the most common cancers in women. And in India, there's still a lot of lack of awareness, I should say, about breast cancer. And a lot of our women get diagnosed in advanced stages of breast cancer. And I think like Amit pointed out, many don't want to come into a hospital when they're normal, and breast cancer is something that can be actually picked up very early in stage one with routine clinical examinations and mammogram. But yet, women don't want to take that, push to come in for their own health. And I think that's where these girls come in, because we send them out into the community, into people's workplaces, to actually screen, at least do a physical breast examination, and if not, maybe in a stage one, at least a stage two, or at least a stage three breast cancer should be picked up. And I think it all starts with examining these women. Women learn the self-awareness about the breast comes in, and I think the girls also chat with them about the signs and symptoms of breast cancer. And there's a one-to-one impartment of knowledge, which I think is very crucial, because despite Google and despite the bounty of knowledge that is available out there for us, when you read it, it just goes off your mind. But when you see it, feel it, have someone talk to you about it, I think that's when the knowledge sticks around. And uh, uh, and I think it empowers women in general, and helps them to understand what breast cancer is, what are the symptoms of breast cancer, what to look out for, and seek medical attention early. So do we have a PPT, Amit, which we could probably put up?
Yeah, Ashwini,
Yeah.
do you
Guys,
want?
yes, Gayatri,
Or
we
if
have
you want, I
already
could just
shared.
have
Yeah,
I could just chat about it also, no problem.
uh,
Gayatri, what is the thing that I've already shared the PPT with you.
With me, I am sorry, I don't have it, Ashwini.
Okay. Uh, Dr. Puama, you can do it.
no,
So,
Ashwini,
Oh,
or
okay.
I
I
think,
can
So
share it
I
right
think
now. I can share it right
no problem. I can just talk. I can just talk offhand. No problem. I think doesn't make a difference to me.
now. Okay.
So I think coming to cancers nowadays, cancers has become very common. Every other person of, extended family, friends have cancer. And for women, breast cancer is the most common cancer. It's a lifestyle disorder. So the question as to why did I get breast cancer, there is no answer to it. So the simple answer is you're a woman, you're aging, and just about anybody can develop breast cancer. And the other thing people say is like, okay, only older women will develop breast cancer. Again, that is a complete myth. We have a lot of young girls with breast cancer, girls as young as 20, 23, 29, 30. So age is really not a criteria. And breast cancer is very different in Indian women compared to the Western world, in the sense it occurs in much younger women in India. And there is no absolute risk factor as such for breast cancer. So what we would say is, as you age, uh, in case your periods start very early, if your periods start and end very late, or you don't have children, or you have children very late in life, in case you're exposed to a lot of hormones or postmenopausal hormone replacement therapy, all of that increases risk for breast cancer. Only about 5 to 10% of breast cancers are genetic or hereditary. So please note, you don't have to have a family history of breast cancer, because many people will come. The first thing they'll tell me is, I don't have anybody in my family who has cancer. So how the hell did I get cancer? And that's normal. 90 to 95% of breast cancer patients will not have a history of cancer in the family, and they probably would be the first one with the cancer. Now, coming to the signs and symptoms of breast cancer. So, what happens is, most often what brings somebody to the doctor is a pain anywhere in the body. Now, many cancers, including breast cancer, is a very silent problem for a very long time. most often the only complaint or the only thing the women would have probably noticed is some kind of a lump in the breast. Okay, some kind of a small lump, a little bit of a thickening, or some area in the breast which looks very little different, feels different. And I think that's the most common thing. Most patients will come and tell me, I did feel something different here, but it's absolutely painless, doctor. So that's why, I mean, it's painless. So why should I get it evaluated? But that's the common sign of a breast cancer. Just a lump in the breast, some kind of a thickening in the breast, most often painless. Once in a while, yes, you could have some kind of a niggling pain or like a prickling prickle or a tingling sensation. So that's the most common symptom for breast cancer. Some other times, all you would probably notice is just a heaviness in the breast. So what happens is the breast is a huge organ. So you could have a small tumor deep in the breast where you may not be able to feel the lump, but the lump, causes fluid accumulation in the breast. So the whole breast feels very enlarged, feels very heavy, and the skin starts to look thickened, and the nipple areola starts to look little thickened. You could also notice that the nipple sometimes is just being pulled inwards towards one side or pulled in one direction. That again tells us that this could be symptoms of breast cancer. Very rarely, all you could notice is also just spontaneous nipple discharge. And when I say nipple discharge, it's not nipple discharge that you squeeze your breast, press your breast, and then you get one drop, and then you get panicky and say, oh, I had nipple discharge. No, just spontaneously it's coming out, especially if it's clear or pinkish, bloody or bloody nipple discharge is something that we would be worried about. Sometimes it could also just maybe not have any lump in the breast, but you might notice that there's some kind of a lump in your underarm, which is again suggestive of a cancer in the breast. So any kind of a change in the breast which is persisting beyond one menstrual cycle, we would say please get it evaluated. Please don't tell women that, oh, it's just related to your cycle, so you can neglect it. Oh, it's not painful, so don't worry about it. And that's how many of the cancers get detected very late. Any change persisting, get it evaluated. The standard test that we would do is a mammogram of the breast and an ultrasound of the breast. We also recommend that all women above the age of 40 go in for a regular clinical breast examination or a tactile breast examination along with a mammogram at least once in a year or maximum once in 2 years. By doing these tests, what happens is very, very small early breast cancers, early tumors, even tumors as big as 5 millimeters can get detected. And the difference is that, a stage 1 breast cancer has a cure rate of 96 to 98%. And this dramatically falls to, a cure rate of 80% for stage 3 and 20 to 25% for stage 4. So that's the difference which is there, So doing these screenings help to pick up cancers way before the women would have, picked it up herself. So please encourage all the women around you to go for screening. And that's why I say I talk about, discovering hands, because many a times forget mammograms. We keep getting women to come for routine mammograms is a really difficult challenge. So at least by sending these people out into the community, at least the palpable ones, at least the stage 2 breast cancers or stage 3, which are completely being neglected, can get picked up by these girls. And these women who have something are told, to come in for a mammogram and to come in for a check. So at least the obvious breast cancers don't get undiagnosed or go undetected. And, and then we are seeing these girls later in stage 3, stage 4. I think that's why what Discovering Hands can do out to the community has a huge scope to pick up these cancers early. So once we pick up something is different, abnormal, we will collate the information we get from clinical breast examination, from a mammogram or ultrasound, the information that we get, we'll collate it and then decide whether we're going to do a biopsy or not. So a tissue biopsy is the confirmatory test for breast cancer. So we give local anesthesia, put in a needle, take small pieces from that lump and send that for testing to confirm whether this is breast cancer or not. And once a cancer is diagnosed, then there is a pathway that we follow for treatment, which could involve surgery plus or minus chemotherapy, radiation therapy, hormone therapy, depending on the type of breast cancer they have. So I always tell patients, please talk to your doctor. Don't go back and, discuss with your relatives, friends of friends, what kind of treatment they had, because treatment is individualized to what kind of cancer they have, what stage of breast cancer do they have, what subtype of breast cancer do they have. So treatment is individualized for that. We've come a long way in cancer care. And so please talk to your doctor. The other thing I want to really stress upon is that I think we should, spread awareness about breast cancer, remove the stigma attached to breast cancer.
Dr. Poma, you're on the mute.
Just say they have a lump in the breast. Sometimes women feel shy. I think so. We need to have these conversations out there to decrease the stigma attached to breast cancer. And I think I also mentioned about treatment. So the treatment could involve, a component of surgery, chemotherapy, radiation therapy, hormone therapy, targeted therapy, depending on the kind of breast cancer they have. So I think that's in a nutshell about breast cancer. Maybe if they have any questions, doubts, I'd be happy to answer them. I'd also talk about, self-breast awareness. I think what every girl should know is, how their breast look like and feel like. And what we advocate is once a month, every month, lie down, feel yourself, feel with the, the flat surface of your fingers, gently press down and roll and feel your breast for any kind of changes, abnormalities. That will really help to, pick up these cancers early.
So, Ashwini, if there are any questions,
Yeah.
just feel free to let the team know.
Sure.
Otherwise, we can anyway follow up. You can collate the questions. You can send to us, and I can get Dr. Puamma to respond to them also on the mails.
Sure. Gayatri or Dr. Renuka, any questions from the audience?
Yeah, thank you. Thank you so much, Dr. Kovama, for this. Thank you so much for giving us a very quick but such a easily understandable overview, actually, of what we should all be mindful of. And I'm sure this is going to help everyone who's attended. We already have a couple of hands that have been raised, so I request Tushar to help with the spotlighting. So I would now like to request Sapna, to come up with her first question. We'll just wait till you're spotlighted, Sapna. Okay.
I'm ready with my question. Right. So just in case there's some cancer, some tumor, something in the breast, would you be able to just walk us through the different therapies, or what's the treatment that is to be expected?
For a breast cancer, you mean, or for any kind of a thing in the breast? Hello?
It's for breast cancer specifically.
So breast cancer, once we have a diagnosis of breast cancer, we would also look at the molecular subtype. And then when it's the intention of the treatment is to cure the disease, there would be surgery. Depending on the size of the tumor to the breast ratio, we can either we can just remove the tumor and the lymph nodes, or sometimes we may have to remove the entire breast. But sometimes if that happens, we always offer the patient a breast reconstruction. We can make breast like immediately, and then depending on the stage and the molecular subtype of the chemo, to increase the cure rates, we may have to give them injections or chemotherapy. Again, depending on the molecular subtype, we may add on hormone therapy, targeted therapy to increase cure rates. And once we save the breast, or depending on the stage, radiation therapy also forms a component of the treatment. So there's a component of surgery, injections, radiation, tablets, which are all given to the patient.
All right, thank you for the clarity. Hello, thank you very much for that explanation. Say
Yes.
we detect that there is some, okay, for example, how do we detect, like there's nothing, like, for example, we do have some symptoms for other sicknesses and ailments, right? So do we detect like only with a lump, or would you have any visual images as to how the breast cancer can be detected? Would you have like
So the
images?
most common symptom is a lump in the breast. Okay, so unless you feel it, many a times from outside, the breast will look completely normal. It's only when you touch and feel the breast you might realize, yes, I feel this one area looks different, or I feel something ball-like in the breast, or I feel something different in the breast. So from visually, it's usually I would say the symptoms are usually for a little advanced breast cancer, where the entire breast can look a little shrunk, or it can look very enlarged, or the nipple is pulled inwards or pulled towards one direction, or the breast skin itself looks very different. It looks like the skin of an orange, right? So those are the visual symptoms of breast cancer, and those typically tend to occur in a more advanced breast cancer. They're very, very subtle changes in the skin. The skin, if you feel the nipple areola, which is thin and soft, can feel very thick and it feels very thick and different. Or you could just have this heaviness in the breast. So the most common early symptom is something, there's nothing visual, the breast look absolutely normal. It's only when you start feeling your breast that you feel, okay, one area feels very different. There's some kind of a lump over there. There's some kind of a thickening. There's some kind of a mass over there.
Okay, thank you very much. So then what is suggested is after the age of 40,
40.
the
So
mammogram
the age is, yes, we say after 40, but for all women, even younger than 40, if they feel anything different, please get it evaluated, because we are seeing a huge breast cancer patients in their late 20s and a lot of them in their 30s. So technically, it's something that we don't have enough data on, but in India, we do know that the patients are getting younger and younger. So mammograms for all women above the age of 40, in between lesser than 40, we would say anything different you feel, please get it evaluated, because so many youngsters with breast cancer, and youngsters, a delay in diagnosis of even 6 months can change a cancer from a stage 1 or a stage 2 to stage 3, and sometimes even worse than that. So any kind of a change persisting beyond 1 month, you feel your breasts feel different, please get it evaluated. There's absolutely nothing lost by doing a test and proving that whether there's something there, or if there's nothing there, that's good. But I think prevention or early detection is very important when it comes to breast cancer. And that's why get to know what your breasts look and feel like. Anything different, get it evaluated.
Thank you. Thank you. I have another question.
Yeah.
Yeah, yes, I have seen that, and then there was a surgery. And so does that become, so,
yeah,
right.
Tell me.
So once the cancer, yes, okay, it said that once, the surgery is done, that she's heard, this particular person, Misha, has heard that there's loss of in this hair fall. And
So
so
that's
is that a
usually,
common
yeah,
thing?
that's usually from the treatment that is the side effect of the chemotherapy. Hair falls, but that's a temporary side effect. As soon as chemotherapy is over, within 1 month, the hair will start to grow back and come back to its normal state. But yes, that's a side effect of the chemotherapy that's given.
All right. Thank you very much. Thank you for that.
Dr. Bhuama, I'm very sorry to interrupt. It will take like 30 seconds for the interpretation. Okay, so
Yeah,
that's
yeah.
why that there is a gap.
Yeah, no problem. No
Yeah.
problem.
Okay.
No problem.
All right. Yes. So you mentioned that, you know, with a lump or anything extraordinary, then we can just, yes, then we know that there's something wrong and we go for a checkup. But then say, for example, the detection or whatever, maybe something is not found initially, but the detection by the individual themselves, you know, the lump or any such thing, if they find that very late and then they go for a checkup, is that curable through treatment?
So,
Sorry, I cannot hear you, doctor.
yeah, so stage 1, stage 2, stage 3, okay. Stage 4, if the cancer has spread beyond breast, then we say, okay, cure may not be possible.
Dr. Puvama, your voice,
Yeah, so stage,
it's not very clear. Your voice is dropping.
I'll just try and pitch in. If am I audible, Dr. Renuka?
Yes, yes.
So, what Dr. Puama is saying, if it is in stage 1 and stage 2, the cure rate is much higher. So, in fact, in stage 1, it is up to the 95 to 98%. Whereas when we are talking of stage 4, the cure rate actually drops below 20%. And to some stage, it's kind of become uncurable. So that's why the importance of screening is more important, because by such screening methods, we are able to find the disease as early as possible, possibly in stage 1 disease.
All right. Get that. Thank you. Yes, another question I have is, yes, you mentioned about the stages, and the late detection results in, you know, not a successful, you know, cure or therapy, right? But if we detect it and it is at stage 4, would that result in the removal of the breast, in the surgery happening?
So I think a little bit of your question, but so in the stage 4 breast cancer, we probably wouldn't do surgery because the cancer has spread beyond the breast to other areas. Okay, so in a stage 1, stage 2, and stage 3, we would treat it with surgery. But in a stage 4, if it's spread beyond the breast, we would only operate if there are local problems or wound the breast, things like that. But otherwise, we defer surgery for a stage 4 breast cancer.
Sorry, could you please repeat the last bit, doctor?
Yeah, for a stage 4 breast cancer, because the tumor has spread beyond the breast to other areas in the body, we may not have to operate on the breast, and we will try to keep the cancer under control with injections or medicines.
Thank you. Thank you for that very clear explanation, doctor. Yes, I have two questions.
Yes.
Yes, in examining,
Mm.
you said that how often does that self-examination should be happening?
So
Like
what we
how?
recommend is once a month you examine yourself, your period is over.
All right, doctor. The next question that I have is, yes, when we are breastfeeding, say for example, a year or so, after that, then is there chances of one having that cancer right after the lactation period?
So yes, breast cancer is one of the most common cancers that can occur even during pregnancy. Okay. Breast cancers are also common during the lactational period, and many a times during this period, cancers are diagnosed late because it's thought that it's a milk lump or it's an abscess, and diagnosis is usually late in this subset of patients. But yes, anything during a pregnancy, any lump during a pregnancy, post lactation, please get it evaluated, because breast cancers, I've had quite a bit of patients during pregnancy, post pregnancy, during lactation who have developed breast cancer. So what we say is 1 in every 3,000 pregnancies can have breast cancer.
Sorry, the numbers, doctor?
1 in every 3,000.
During lactation, like how does that happen? Is there a reason for breast cancer? Is that because there's the milk supply is not completely consumed by the child or anything like that?
No, it's not related to the milk or the milk production or something. It's just that the state of pregnancy is about 5 years.
Sorry, doctor, lost your voice there.
Because of the harm produced, or
I think your voice
the
is
pregnancy
dropping,
itself can
so I cannot hear it clearly. The last part was missed.
Yeah, the pregnancy itself can induce this cancer. It is not really much.
Doctor, your voice is
anything left.
dropping. We are not able to hear you clearly.
You pick up the signing, Manisha. I will do the voicing then.
Dr. Puama,
I think ma'am is just rejoining the meeting. I don't see the audio symbol, so we just wait for a minute or so.
Okay. Okay, so there is one question from the participant.
So maybe you can, maybe she can ask the question, and once doctor joins, we can see if her audio is better. Ma'am, are you able to hear us?
Yes, I can hear you.
Oh, okay. So we have some more questions actually. So maybe the next person can also.
Yeah.
टाकू नाही तिला दे आता सगळं चांगलं शिकते.
Taisi, can you please unmute Xiomi?
Okay, so there is a question from one deaf participant. So, okay, so she's saying that she was just thinking if there is any young woman who has been, I mean, gone through uh, cancer, and she might be has gone through some from chemotherapy, and then she might be missing on her menstruation cycle, right? So, will that happen in case of the cancer? I mean, will it be possible if a person is going through a chemotherapy? Can the person have a menstruation again if it has been stopped during that medication period?
Yes, that is very common. That is very common. Sometimes during chemotherapy, the menstrual cycles stop. And for younger women, we do give them injections purposely to stop the menstrual cycle so that we can protect the ovaries. And once all the chemo is over, usually will restart after some time, not immediately after the chemo is stopped, but after a few months or maybe up to a year later, the cycles will restart. And they can go on to have a normal children also post that. I've had 2 or 3 patients who had cancer and then had gone and had children also.
Okay, so she's okay. She, I think, didn't listen this point. So she's saying that that woman can also go for conceiving the child as well. I mean, will that be okay?
Yeah. Yes. Yeah, that should be fine.
But she is not having menstruation. But she want a baby.
No. Menstrual cycles has to start. So menstrual cycles has to start for you to be able to conceive, right? The cycles have to start.
Oh, okay. So if in case,
Yeah.
a person is not able to conceive a child, can a person go ahead for IVF?
So it depends on what kind of cancer they've had. For breast cancers, if they're hormone positive type of breast cancer, we would tell them to better avoid, or we'll have to customize the treatment for them, not the standard IVF.
So she's asking the question once again. I think she hasn't maybe clarified with the answer. Could you please answer the question once again? Whether the person can go ahead with the IVF or not?
So it depends on what kind of cancer they've had. Okay. If it's breast cancer, say, or ovarian cancer, then we would have to standardize the treatment. We have to change the treatment a little bit because the standard routine IVF may not be possible because they'll be giving them too much of hormones, which should be unhealthy. But normally, if they conceive, and otherwise, we have to change the medication a little bit if it can't be the standard IVF.
Okay. Thank you. Thank you.
Yeah, Rupa can go ahead with her question.
So Rupa was mentioning I have a concern when we talk about the breast cancer. So is it something that if we did not conceive any, I mean, if we did not conceive in that case, also we can more risk to getting the breast cancer? Is that possible?
Yes. Men who don't have children are at a higher risk of developing breast cancer. It's one of the risk factors.
So what could be the solution for this? Or, or she's asking one more question. If in case a woman has a child, she is not having any milk and she's not able to breastfeed the child. So what she is supposed to do during that time? She can feed.
So please talk to your doctor at that time. They can give you medicines to increase milk production. And if milk production doesn't happen at all, rice or formula feed would be the option. But
Sorry.
most women, if taught how to breastfeed properly, if more women, if they're taught at the right time and in the correct way, they'll be able to breastfeed and
Sorry, doctor,
given
could you please
adequate
go back
battery
again? Your voice is
breast.
dropping. Could you please
I
answer
said
the
what
question?
is important with breastfeeding is to start it at time, get adequate support, get adequate nutritional advice, and in most instances, breastfeeding would be possible.
But if in case, if we are feeling that we are having a heavy breast, so can we, I mean, is it a right way to get the milk, I mean, to get the milk from outside and then extract milk? We can give the extract milk to the child. Will
Yes,
that be okay?
yeah, you can do that. You can extract the milk and give it to the baby also, no problem.
Okay. So if I'm feeling sick or I'm having cough and cold, if I'm having medicine at that time, can I still breastfeed? Will my medication will affect the child during the breastfeeding?
Yes, some of the medicines can go via breast milk to the child. So before when you breastfeed, please talk to your doctor before you take any medicine. It can go to the baby. So before you take any medication when you're breastfeeding, please talk to your doctor.
Okay, sure. And one more question. So when I was breast feeding my child, once the lactation period was over, uh, sorry, I need to ask the question again. Okay. So when the lactation period was over, I was having a pain during when I was lactating. I was having a pain, and I thought that I should extract my milk. But after that, I was breastfeeding my child. But will that milk will affect my child also if I'm having pain and I realize that I might having some lump? I should extract the milk.
Absolutely no problem. You can extract the milk and give it to the baby. Absolutely no problem.
So no problem if in case I'm having pain and feeling that there is a lump, still
It's okay if you have pain also, no problem. Yeah, you can breastfeed, no problem.
okay. Thank you so much. Thank you, doctor.
All right, this is Gayatri here. I'm just going to come in. Ma'am, since we are already at 6 o'clock, I just wanted to understand how much time you would have to be on this call. I understand we've already taken quite a bit of time. That will just help us know how many more questions we can take.
How many more questions do you have? Maybe another 5
I
minutes?
can see, I can see 5 people who've raised their hands. If we have about 5 to 10 minutes, maybe we can take two more questions, and the other questions we can see how we can
Yeah,
get that across to you.
Yeah, so I would
we
say
can do that. Yeah.
probably we'll take two more questions. And for balance, Ashwini can collate all the questions and
Yeah.
send to us in email, and we will respond back.
Yes, yes, will do.
Sure, sure. Thank you for that, and thank you, Ashwini, for that support. So I think Sonia has raised her hand, so she can go ahead.
Yes, I'm here. I hope you can see me clearly. Yes. So I have one query. So for example, when we are wearing our bras,
When we wear bra in the night, does it
yeah, when we
cause,
wear the
is it
bra
a
in the night,
cause?
yeah. So if we are wearing it for the entire day and also we are wearing it
In
during
the
night
night.
time as well, can it also be get us breast cancer? Will that be can be a reason as
So, okay. Yeah, no. That's a complete myth. The kind of bra you wear, whether cotton, synthetic, nylon, underwire, black, white, wear during the night, wear in the daytime, wear it while you sleep, don't wear it, has no association with breast cancer. Absolutely no association with breast cancer. So no association between any kind of bra you wear, don't wear, what color, what material. None of that is related to breast cancer.
Okay, okay. Thank you. And one more question.
Hello?
Earlier you were saying, so if
Yes.
a person, who has to check.
Mm.
Okay, so she's saying that she checked when she was lying on her breast side and she saw there was some yellow color of water was coming from her right side of breast. So could that be a reason of breast cancer as well? There was some discharge, a yellow color discharge.
Any kind of has to be rated.
Sorry, doctor, your voice is dropping. Sorry, doctor, I'm not able to hear you out.
So if you have any kind of nipple discharge, please meet your doctor and get it evaluated. Very rarely nipple discharge could be a symptom of breast.
Okay, clear, clear. So there is one more person along with Sonia want to ask a question. So for example, if I think I don't have a cancer, but you are okay, so is there any myth that if you sweat a lot, then you might not get any kind of cancer? Is there anything like that?
Like that. Whether you sweat, anybody can develop cancer. There's no association between cancer.
Okay, and the second question is, so during the night time, is there any sleeping position which is preferable for women so that they cannot get the breast cancer?
No, there's no absolutely no sleeping position which can help.
Or if we sleep on our stomach?
No, no relationship to breast cancer.
Okay, thank you. Thank you, doctor. Okay, so Pranamya is having the question now. Pranamya is saying that I have understood about all the things which we have learned today about the breast cancer. But I just wanted to know how does it happen, whether it's related to the weather change or maybe if we have taken any wrong medicine, what could be the reason, whether it could be a food habits, anything like that?
So breast cancer is a lifestyle disorder. We cannot pinpoint and say this is the particular reason you're developing breast cancer. Any women with age can develop. Early the onset of periods, late ending of periods, not having children late, obesity, alcohol, stress, lack of physical activity, all of that can increase risk for breast cancer.
Oh, okay, that could be any reason. Okay, I was just thinking maybe the
Yes.
food habits could be a reason for it.
Yeah, so obesity is a risk for breast cancer. Alcohol is a risk for breast cancer. Lack of physical activity is a risk for breast cancer.
Oh. Okay, okay, understood. Thank you so much. Thank you, doctor.
All right. I know I can see more people who've raised hands. Unfortunately, we won't be able to take any more questions for Dr. Povama because, we've already taken a lot of her time in her schedule. Thank you so much on behalf of all of us, Doctor, for sharing so much information with us. For even busting some of the myths that many of us may believe about breast cancer and just what we can do about that. Thank you, a very big thank you to you and to Amit sir for patiently answering all of our questions. Um, and we also have Ashwini here on the call. We've already heard from Ashwini, but I just want to take this chance to introduce her formally to everybody here. So Ashwini, like Amit sir said, is actually a certified trainer of the Discovering Hands program from Germany, and she leads the Discovering Hands program at Enable India. And while Amit sir also did briefly tell us about the program, Ashwini, I just want to request you to just tell a little bit about how the method is. If you could just tell us very briefly, so that everybody here gets to know about what the camp is, and if anyone is interested to get screened, we can then share the ID later.
Yeah,
So,
yeah.
Ashwini.
So the Discovering Hands program is for about 9 months. First 6 months, we will teach them on the domain skills, which includes how to palpate through touch and feel, that is from first two fingers of both the hands, and the communication, English communication, computer, how to use computer, and how to be independent, that is with the mobility. All that will be included in the first 6 months of the training. And after the 6 months, we will give them the exam that will be conducted by German only, Discovering Hands German. They are going to conduct the exam. Once they get through the exam, MTEs, the candidates will go for the internship for the last 3 months at a hospital. Like now, the first and second batch, they went to Cytecare and Apollo. The same way, they'll go for 3 months for an internship. Once the internship is done, they'll come back to Enable India and they have to give the practical examination, which is also conducted by Dr. Frank Hoffman himself and his team. And once they pass in the exam, they will be called as a medical tactile examiners. Now they are certified to do the screening. Okay, so during the internship, which will be in the hospital, they will get a lot of exposure with the real patients. Through the support of doctor, the gynecologist or oncologist, they will get to know where exactly the tumor is located, how the tumor, the size, shape, everything. And they will also have a lot of exposure to the operation theater, that is a OT. Okay, once a tumor is removed, how they feel, that is also the one of the kind of exposure they'll get it in the hospital. So once the practical exam is done, they'll be certified as a medical tactile examiners, as I said, and now they are eligible to do the screening. Till now, our both batches medical tactile examiners have screened more than 1,000 plus women, and uh, now, if anybody are interested to get the screening done on this methodology, uh, please come forward. Or if you have any doubts, reach out to me. I'll be more than happy to clarify you. And for the deaf people who are at Enable India, I'm there. I'll be sitting in the first floor, TH room. That is it.
All right. Thank you. Thank you so much for that, Ashwini. I think it's been a very insightful session. And I think for many of us here, it may be the first time hearing. One is to know about breast cancer itself and all the myths, but also to know that there are women who are visually impaired who have this livelihood opportunity. I think that itself is a very big learning. There's one question on the chat where someone has asked any hospital available. So could you tell us about which hospitals, I mean, you've said Cytecare and Apollo. Where in Bangalore are these hospitals?
Yeah, Cytecare Cancer Hospital is in Yelahanka, Airport Road, and Apollo Hospital we have tied up with the Bannerghatta branch.
Right.
Yeah.
So right
Slowly
now,
we are also
because,
connecting with BTS Global. Yeah.
Okay. So right now it's with private hospitals because someone has asked if there's any government hospital as well. Uh,
Yeah, NAB Delhi, they have tied up with the government hospital, which is in Gurgaon. Recently, it has come in the newspaper also. There are two people are working there, two MPs are working.
We also have another staff member of Enable India, Rituparna, who's on the call, who manages the SEA Million program at Enable India. I know a lot of the time has gone into Q&A with the doctors, but Ritu, just want to ask you if anybody wants to get screened themselves or wants to organize a screening where they are, how can they approach the Discovering Hands team? Would love to hear from you as well.
Oh yeah, thank you, Gayatri. Hi, this is Rituparna, and I work at Enable India. So, if to answer your question, Gayatri, we do have currently four MTEs, medical tactile examiners, interning at Enable India. So they are, wherever there is a need or a demand, and wherever there is a request which comes from any partner organization hospital, these MTs are currently stationed here, and they go out and get the screenings done. However, to make things easier for people in and around in and around Bangalore, you can also come down to Enable India to get the screenings done, because the MTs are always here. You just have to let us know a little in advance, and you can either reach out to Ashwini, me, on our email IDs, which Gayatri can put it in the chat box, and we would be more than happy to host the screening camps here at Enable India. So yeah.
Great, great. Thank you so much, Ritu.
And please keep an eye on our Enable India social media pages, because wherever there are screening camps happening, we keep updating our social media pages. So that will help you to get to know where all the camps are happening.
Wonderful, wonderful. I'm sure everyone here is very social media savvy, so they'll definitely come to know. Ashwini, was there something you wanted to add? You're on mute, Ashwini. You're on.
So I just want to put a note here, like we can't put the screening wherever it's happening in the social media because of their wish, okay? Because few of the apartment people or the hospital, they tell, no, you don't put it in the social media. So that is why we'll ask them and then put it across. But
yeah, I meant to say wherever is possible, wherever we get an approval, we do keep updating. So please keep an eye.
Yeah.
Sure, sure. That's good to know. And even on the chat, I have put the email ID, which is DH. DH stands for Discovering Hands at enableindia.org. So if anybody here, wants to get in touch with the team to either get screened yourself, or if you want to organize a screening where you are, we would encourage everyone here to send an email ID, and we'll see best, how we can meet your requirement. Both the experts from Cytecare Hospital, that is Mr. Amit and Dr. Puvamma, have left the call because of other commitments. But if anybody on this call has any questions about the Discovering Hands program for Ashwini or for Ritu, do raise your hand. We will be able to take one or two questions, and then we will close the session.
Just wanted to say, if there's any question also specific to the training part, because there's like Ashwini mentioned, it's a 9 months training which happens only at Enable India right now and at NAB Delhi. So if there's any question where you want to understand the criteria and how the training happens, we would love to answer that.
All right. I think at this point, there are no questions about DH, but for those who are on the call, if you do have anything you want to ask about the program also, please feel free to, write to the ID shared on the chat. On this note, I just want to thank, our experts. Oh, sorry, there is one person who's raised their hand. Sorry. Let's see. In the spotlight. Yeah. Yeah, Priya can actually go ahead with her question. Yeah. Are you able to see her, ma'am?
Her connection is very poor, isn't it? It looks very patchy. Very patchy, isn't it?
Yeah, I think the sign freezes mid-air. Yeah. Maybe we can come back to Priya, or you can put it on chat, your question.
Okay, so my question is that again, after after I stopped lactation with my first child, and then I had a second child, and then I am done with lactation, but then my breasts seem to have shrunk and gone smaller. So is that a normal thing, or is that anything to be
No,
concerned about?
no, there's no concern in that. It is normal, but after if she is above 40 years, request once you go and get the screening done on the DH methodology or with the doctor, clinical breast examination.
I'm now 34, so
one suggestion is after her menstruation, that is after 7th day of your menstruation, please do a self breast examination. So if you find any suspicious finding in your breast, or if there is any changes in the breast, for example, there were no orange kind of a skin before, like 2 days back, but now I've started noticing it. Okay, so that is a concern. Immediately you have to reach out to a doctor. So I suggest every woman, you have to do the self breast examination after your 7th day of your period till 15th or 16th day. That is a very good period to do a self breast examination.
should we just examine it
No,
after?
there is a methodology how to do the self breast examination. Once when you come to Enable India office, our girls will be there, or I can teach you how to do a self breast examination, and from there you can start doing.
Thank you very much.
And there are videos to do which shows how to do a self breast examination. So you can watch that also in a YouTube.
All right, thank you very much.
Sorry, there are lots of questions, but not enough time. But maybe we can take one more question because we do want to wrap up by 6:30. So I'll just take whoever's hand was raised first, right? And I'm sorry for those who are not. We're not able to give you a chance, but you can, send in your email, and we'll see how best we can respond to you. So I'm just
Yes,
taking the
Gayatri,
last question.
if
Yeah,
if there are questions for a doctor, they can send, or for me, that
sure,
is also fine. Yeah.
sure.
Okay, so to prevent breast cancer, anything to do with diet, any specific, steps that we can take to
No, with the
avoid?
diet, yeah, as doctor said, uh, the cancer will not come through the food or anything, but you have to be careful, no smoking, no drinking, the usual the health precautions that you have to do. You have to take it.
All right. Thank you. Thank you very much.
All right. I know that there are some more questions, but we will have to, end the session. So first up, I really want to thank you, Ashwini, because you've been very instrumental in the Discovering Hands program as a subject matter expert. So really a big thank you for taking the time out, sharing. Because as you said, there are so many screenings going on. Just today, you all were at ISRO, and I know that there's a lot that you're managing. So as a team, we really appreciate the time you've taken out, and also you were able to get the experts from Cytecare Hospital. A very big thank you to Mr. Amit and Dr. Povama as well. Thank you so much, Ritu. I know this was a conversation we had on how do we bring this program to deaf women. So thank you so much for your support as well.
Thank you.
Thank
Yeah,
you.
and also want to thank our interpreters, Dr. Renu and Manisha. Thank you so much for all your support and making this a session inclusive for everybody. And I want to thank all the participants here. Hopefully, this has helped you, and it will also help you help others. If you want to break the myths that others may have, because it's very important for this information to reach many more people. So thank you so much, and also to the team, who has the Here a Million team for all their support. So thank you once again. Wishing everybody here a very happy International Women's Day in advance. And while this is just an occasion to talk about health, I'm sure we all realize that health is something lifelong, has to be taken care of. And hopefully, this session is just a reminder of that. So, on that note, a big thank you once again, and wishing everybody here a very good evening. Thank you.
Thank you.
Thank you so
Thanks.
much. Thanks.
Thanks.